Hey, Alpha Nurses, I'm Licensure from AlphaNurseGuide.com. This is 12 practice NCLEX questions. Without delay, let's get started.
A multigravida client is admitted to the hospital with a diagnosis of ectopic pregnancy. The nurse anticipates that, because the client's fallopian tube has not yet ruptured, which of the following may be prescribed? 1. Progestin contraceptives. 2. Medroxyprogesterone. 3. Methotrexate. 4. Diphyline. The correct answer is 3. Because the fallopian tube has not yet ruptured, methotrexate may be given, followed by leucovorin. This chemotherapeutic agent attacks the fast-growing zygote and trophoblast cells. RU-486 is also effective. A hysterosalpingogram is usually performed after chemotherapy to determine whether the tube is still patent. Progestin-only contraceptives and medroxyprogesterone are ineffective in clearing the fallopian tube. Diphyline is a bronchodilator and is not used. After instruction of a prima gravida client at 8 weeks gestation diagnosed with class 1 heart disease about self-care during pregnancy, which of the following client statements would indicate the need for additional teaching? 1. I should avoid being near people who have a cold. 2. I may be given antibiotics during my pregnancy. 3. I should reduce my intake of protein in my diet. 4. I should limit my salt intake at meals. The correct answer is 3. The client needs a diet that is adequate in protein and calories to prevent anemia, which can place additional strain on the cardiac system, further compromising the client's cardiac status. The client should avoid contact with people who have infections because of the increased risk for developing endocarditis. The client may need antibiotics during the pregnancy to prevent endocarditis. Limiting sodium intake can help to prevent excessive expansion of blood volume and decrease cardiac workload. A prima gravida client with insulin-dependent diabetes tells a nurse that the contraction stress test performed earlier in the day was suspicious. The nurse interprets this test result as indicating that the fetal heart rate patterns showed which of the following? 1. Frequent late decelerations. 2. Decreased fetal movement. 3. Inconsistent late decelerations. 4. Lack of fetal movement. The correct answer is 3. A contraction stress test is used to evaluate fetal well-being during a simulated labor. A suspicious contraction stress test indicates inconsistent late deceleration patterns requiring further evaluation. A negative contraction stress test indicates no late decelerations and is a desired outcome. A positive contraction stress test indicates fetal compromise with frequent late decelerations. Fetal movements are one of the parameters of biophysical profile and are detected with non-stress testing. Decreased or absent fetal movements may indicate central nervous system dysfunction or prematurity. Lack of fetal movement or decreased fetal movement is not associated with contraction stress testing. In which of the following maternal locations would the nurse place the ultrasound transducer of the external electronic fetal heart rate monitor if a fetus at 34 weeks gestation is in the left occipital-anterior position? 1. Near the symphysis pubis. 2. 2 inches above the umbilicus. 3. Below the umbilicus on the left side. 4. At the level of the umbilicus. The correct answer is 3. As the uterus contracts, the abdominal wall rises and, when external monitoring is used, presses against the transducer. This movement is transmitted into an electrical current, which is then recorded with the fetus in the LOA position. The cardiotransducer should be placed below the umbilicus on the side where the fetal back is located and uterine displacement during contractions is greatest. If the fetal back is near the symphysis pubis, the fetus is presenting as a transverse lie. If the fetus is in a breech position, the fetal back may be at or above the umbilicus. Which of the following foods should the nurse encourage the mother to offer to her child with iron deficiency anemia? 1. Rice cereal, whole milk, and yellow vegetables. 2. Potato, peas, and chicken. 3. Macaroni, cheese, and ham. 4. Pudding, green vegetables, and rice. The correct answer is 2. Potatoes, peas, chicken, green vegetables, and rice cereal contain significant amount of iron and therefore will be recommended. Milk and yellow vegetables are not good iron sources. Rice by itself also is not a good source of iron. Macaroni, cheese, and ham are not high in iron. While pudding and green vegetables contain some iron, the better diet has protein and iron from chicken and potato. A child with Kawasaki disease is receiving low-dose aspirin. The mother calls a clinic and states that the child has been exposed to influenza. Which recommendations should the nurse make? Select all that apply. 1. Increase fluid intake. 2. Stop the aspirin. 3. Keep the child home from school. 4. Watch for fever. 5. Weigh the child daily. The correct answers are 2 and 4. Aspirin needs to be stopped because of its possible link to Rice syndrome. Additionally, the parents need to watch for signs and symptoms of influenza. Children with influenza, frequently present with fever, cold symptoms, and gastrointestinal symptoms. Increasing the child's fluid intake and weighing the child daily are not needed at this time because the child is not ill. Keeping the child home from school is not necessary because the child is not ill and has already been exposed. Which of the following findings would most likely indicate the presence of a respiratory infection in a client with asthma? 1. Cough productive of yellow sputum. 2. Bilateral expiratory wheezing. 3. Chest tightness. 4. Respiratory rate of 30 breaths per minute. The correct answer is 1. A cough productive of yellow sputum is the most likely indicator of a respiratory infection. The other signs and symptoms, wheezing, chest tightness, and increased respiratory rate, are all findings associated with an asthma attack and do not necessarily mean an infection is present. A 34-year-old female with a history of asthma is admitted to the emergency department. The nurse notes that the client is dyspneic, with a respiratory rate of 35 breaths per minute, nasal flaring, and use of accessory muscles. Auscultation of the lung fields reveals greatly diminished breath sounds. Based on these findings, which action should the nurse take to initiate care of the client? 1. Initiate oxygen therapy as prescribed and reassess the client in 10 minutes. 2. Draw blood for an arterial blood gas. 3. Encourage the client to relax and breathe slowly through the mouth. 4. Administer bronchodilators as prescribed. The correct answer is 4. In an acute asthma attack, diminished or absent breath sounds can be an ominous sign indicating lack of air movement in the lungs and impending respiratory failure. The client requires immediate intervention with inhaled bronchodilators, IV corticosteroids, and possibly IV theophylline. Administering oxygen and reassessing the client 10 minutes later would delay needed medical intervention, as with drawing blood for an arterial blood gas analysis. It would be futile to encourage the client to relax and breathe slowly without providing the necessary pharmacologic intervention. Which of the following is a priority goal for the client with chronic obstructive pulmonary disease? 1. Maintaining functional ability. 2. Minimizing chest pain. 3. Increasing carbon dioxide levels in the blood. 4. Treating infectious agents. The correct answer is 1. A priority goal for client with COPD is to manage the signs and symptoms of the disease process so as to maintain the client's functional ability. Chest pain is not a typical symptom of COPD. The carbon dioxide concentration in the blood is increased to an abnormal level in clients with COPD. It would not be a goal to increase the level further. Preventing infection would be a goal of care for the client with COPD. When asked about her stresses before admission, an anxious client stares blankly at the nurse and mutters unintelligibly. Which of the following descriptions of the client's behaviors should the nurse document in the client's chart? 1. Client cannot answer any questions asked at this time. 2. Client is uncooperative during the admission procedure, refusing to answer any questions. 3. Client responded to questions with a blank look and incomprehensible mumble. 4. Client stared at the wall when asked questions and was disoriented and incoherent. The correct answer is 3. The nurse must be objective in documenting the client's behavior, recording exactly what the client did or did not say or do in a particular situation. Recording that the client could not answer any questions, was uncooperative and refused to answer questions, or was disoriented and incoherent is not described and is a subjective interpretation on the nurse's part. A 36-year-old multigravida client is admitted to the hospital with possible ruptured ectopic pregnancy. When obtaining the client's history, which of the following will be most important to identify as a predisposing factor? 1. Urinary tract infection. 2. Exercise during pregnancy. 3. Episodes of pelvic inflammatory disease. 4. Use of estrogen-progestin contraceptives. The correct answer is 3. Anything that causes a narrowing or constriction in the fallopian tubes, so that a fertilized ovum cannot be properly transported to the uterus for implantation, predisposes an ectopic pregnancy. Pelvic inflammatory disease is the most common cause of constricted or narrow tubes. Developmental defects are other possible causes. Ectopic pregnancy is not related to urinary tract infections. Exercise during pregnancy is not associated with ectopic pregnancy. Progestin-only contraceptives and intrauterine devices have been associated with ectopic pregnancy. With plans to breastfeed her neonate, a pregnant client with insulin-dependent diabetes asks the nurse about insulin needs during the postpartum period. Which of the following statements about postpartum insulin requirements for breastfeeding mothers should the nurse include in the explanation? 1. They fall significantly in the immediate postpartum period. 2. They remain the same as during the labor process. 3. They usually increase in the immediate postpartum period. 4. They need constant adjustment during the first 24 hours. The correct answer is 1. Insulin needs fall significantly for the first 24 hours postpartum because the client has usually been on nothing by mouth status for a period of time during labor, and the labor process has used maternal glycogen stores. If the client breastfeeds, lower blood glucose levels decrease the insulin requirements. With insulin resistance gone, the client commonly needs little or no insulin during the immediate postpartum period. Although the need for insulin decreases during the interpartum period, the insulin requirements fall further during the first 24 hours postpartum. After the first 24 hours postpartum, insulin requirements may fluctuate markedly, needing adjustment during the next few days as the mother's body returns to a non-pregnant state.
You can get my NCLEX review bundle. Links will be in the description. I'll see you guys in the next video.